Aye, thanks for watching. This is the Governor of Illinois, and I think he's his daily threat. They go on every day and terrorise people. It's not just him. Wait till you hear who else talks, and what she says is unbelievable.
So if an airlift is what it takes to bring the PPE to protect our nurses, our firefighters, our police officers, and other essential workers, then it's an airlift that we'll use without hesitation. Thank you all for tuning in over the weekend. We'll be back tomorrow with our regular update. Before we move to press questions, I'd like to turn it over to our Director of our Department of Public Health, Dr. Angaza Zike, for today's medical update.
Count the mistakes that she makes.
Thank you for everyone who tunes in every day as we report out the latest developments and the Governor shares his plans to help us through this difficult time. Your ability to stay informed and to use that information to make good personal choices is what drives our efforts each day. Our goal is to give you the most up-to-date information that will help you understand, of course, that COVID-19 is very serious, but especially to make you understand the essential role that each of you play in helping Illinois get back on track. Today, I announced that there are 1,197 new cases of COVID-19 and unfortunately 33 new deaths. That brings our state total to 30,357 and unfortunately 1,290 total deaths. I know the COVID-19 pandemic can be overwhelming for parents and is concerning as well to children. As a mother and as a pediatrician, we recommend that parents, guardians, and others who work with young people strive to help them feel understood, empowered, and yes, hopeful. Assure children that doctors and other healthcare workers are learning as much as they can about this virus as quickly as possible and are doing everything that they can to keep them safe. Empower them to keep themselves safe by following guidelines on physical or social distancing, cleaning surfaces, washing their hands, and wearing masks. Encourage them to feel comfortable in sharing their emotions during this tough time. We all need extra support in this unprecedented moment in history. I receive support from my public health team, my local community, my faith community, and my family each day. We all have to support each other in these trying times. COVID-19 has dramatically altered all of our lives. It's changed our way of learning, working, recreating, praying, sharing, everything. It's also stolen precious loved ones from us and even changed how we mourn for them. Though we can never go back trying times, COVID-19 has dramatically altered all of our lives. It's changed our way of learning, working, recreating, praying, sharing, everything. It's also stolen precious loved ones from us and even changed how we mourn for them. Though we can never go back to how we were.
We can never go back to how we were. Right? It gets worse. What does she say next? Right. This is an official admission, by the way. She actually says it out loud. Right? Listen to what she says about COVID deaths. Or deaths in general.
I don't have that information at my disposal at this time. I know we have had people of all age groups die. I just want to be clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So Everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful. And then you also were found to have COVID, that would be counted as a COVID death. It means that if, technically, even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
Can I have a follow-up question? How unusual is it you're looking at the numbers, to have a teenager die from this?
Well, I would say that we know for the pediatric literature that pediatric deaths from COVID are low. I know that as we get older, so obviously a 2-year-old and a 17-year-old are all considered pediatric patients, but we know that the 17-year-old has the physiology much closer to an adult than, say, an infant or a baby. And so as I know that, at former hospitals that I've worked in with and pediatricians that I've talked to, they have seen severe illness in older pediatric patients as they look more like adults than babies.
Of course they do. They're 17-year-old. Yeah, head case. Right, so no matter what you die, whatever the cause of death, you're a COVID, that's it. That's official. Now, in the UK, as far as I'm aware, they're hiring part-time staff who will help with all these upcoming deaths, and they will have the same authority as a doctor or a coroner, and they will be able to sign death certificates. And also in the UK, you cannot question the cause of death, and you cannot get a private autopsy done. Right? So, like she said, no matter what you die, they're putting it down. It's COVID-19. Right, so there's a channel, and I'll link that. Yeah, no matter what, Ellen. Especially, that's why I didn't let you go to the hospital the weekend. I probably never saw you again. I would never have saw you again. Did you not know that? Did you not realise that? Do you think I let you lie on that couch all weekend being ill without doing anything? No. I couldn't phone an ambulance. They take you away on your own. They take you away on your own. I can't go with you. And I can't visit you in the hospital. Anyway, right, what was I saying there? Aye. So, somebody can correct me or what here. I'm sure that this gold braid around these flags, I'm sure that means it's Admiralty law, which would be, well, martial law, just ain't been declared yet. Right, well, thanks for watching. Please comment.